What causes chronic diseases? With 50 years of experience as a physician assistant, I have observed the strengths and limitations of our healthcare system. While acute conditions such as injuries and infections are managed effectively, chronic diseases, including diabetes, hypertension, obesity, heart disease, and cancer, remain persistent challenges. Early in my career, the concept of insulin resistance was poorly understood and rarely addressed. As I explored natural and alternative medicine, including herbal remedies, homeopathy, essential oils, hypnosis, and energy medicine, I realized that even with new tools, chronic disease management often focused on symptom control rather than root causes. Integrative medicine, which combines traditional and alternative approaches, offered new perspectives, but finding lasting solutions for chronic diseases remained difficult. My recent insights have revealed that insulin resistance is a fundamental driver behind many chronic health conditions. These include diabetes, heart disease, inflammatory disorders, high blood pressure, autoimmune diseases, high cholesterol, fatty liver disease, hormone imbalances, emotional disturbances, dermatitis, psoriasis, and chronic fatigue. Addressing insulin resistance can restore normal body chemistry and improve overall health. Insulin resistance occurs when insulin receptors on all cells in the body become less responsive to insulin, the hormone that regulates blood sugar. This leads to a cycle. Eating constantly causes blood sugar and insulin levels to spike. Due to excess insulin, receptors on the cell membranes malfunction, preventing sugar from entering cells efficiently. To reduce excess sugar in the blood, the body creates glycogen and triglycerides. Excess sugar and triglycerides are stored as fat for future use. Lack of sugar inside the cells signals the brain to create sugar cravings and hunger. So, the cycle repeats, contributing to weight gain and further metabolic dysfunction. When carbohydrates are consumed, blood sugar rises and insulin is released. Insulin enables cells to absorb sugar for energy. Excess sugar is stored as glycogen and fat. That was a survival mechanism for our ancestors, but problematic today due to constant food availability. Fat accumulates in the liver, around organs, and in muscle tissue. Fatty liver impairs detoxification, and sugar alcohols like sorbitol can accumulate, causing brain fog and neuropathy. Skin changes, hormone disruptions, and early onset of menopause may occur. Belly fat produces aromatase, converting testosterone to estrogen and contributing to hormonal imbalances and ED in men. Blood vessels lose elasticity, raising blood pressure. Recurrent blood sugar spikes lead to increased insulin production, eventually exhausting the pancreas and resulting in type 2 diabetes. Cholesterol metabolism is also affected. LDL cholesterol exists in various sizes. Smaller, denser particles can infiltrate artery walls, causing inflammation and plaque. The wide-ranging effects of insulin resistance make it a central factor in development of chronic diseases. Addressing it can help resolve multiple health issues simultaneously. So what can we do? Intermittent fasting, also called time-based eating, mimics ancestral eating patterns, reduces insulin spikes, and encourages the body to use stored fat for energy. There is a beverage containing 5 natural ingredients that can boost energy and reduce appetite, helping to break the cycle of frequent eating. It also is a potent anti-inflammatory. Consuming a patented fiber drink that contains 7 natural ingredients, 5 to 15 minutes before your largest meal, slows sugar absorption, preventing rapid spikes in blood sugar and insulin, reducing fat production. The fiber also acts like a prebiotic, feeding the good healthy bacteria, the microbiome in the colon. These good bacteria ferment the fiber and are very important in the production of neurotransmitters for nerve and muscle function, as well as making important compounds like serotonin for mental health. So, what results can we expect? Balanced blood sugar and increased GLP-1 naturally. Reduce dangerous visceral fat, belly fat, normalized blood pressure, cholesterol, and triglycerides, improved liver detoxification, restored digestive and bowel function, stabilized hormones, reduced inflammation, increased energy and fewer cravings, and mood stabilization. Conclusion: insulin resistance is a key factor in the development of chronic diseases. By understanding its mechanisms and implementing targeted lifestyle changes, it is possible to restore health and vitality, body, mind, and spirit. Our motto is, put your health in your own hands. For more information, contact the person who sent you this video, or Bob Huttinga, PAC on Facebook Messenger, or text 989-287-1986, or email bob.huttinga@gmail.com, or go to healinsulinresistance.net.